be putting a stent in. So we're gonna like all rediscuss to see what his options are, and they don't do the stenting here.
Okay.
So we're kind of.
Where do they do that?
It would be like at a tertiary center, probably New Orleans. That's what we just got done discussing, but they still have to talk to ENT.
Okay.
And like kind of decide between us and their team.
I
Like,
thought Dr. Noel was gonna do.
Dr. Norell,
Noel.
Noel.
he's
The GI.
Noel is gonna do a surgical procedure.
for your peg
Yeah.
Yeah,
today.
later today.
Yeah.
I mean, you'll still be here today probably. It's not like you're gonna get transferred like right away. We're still discussing. I'm just letting you know what we're discussing right now.
But what part of my body are you discussing?
The airway. So we're a pulmonology team. I'm Dr. Sajjan. I'm working with Dr. Brown. I'm one of his resident fellows. So we're discussing how we can give you an airway because the mass is like, it's kind of squeezing your airway, and we don't, because it's metastatic disease, it may continue to spread. We don't want it to be completely blocked off because then the options are even more limited. We're basically discussing a way for you to continue breathing. You're doing okay right now. You obviously still have that stridor, but it's really pressing on the tube that provides you air. Okay? And then they had consulted us to see if you could put a trach in, which is like a tube you just put, this is your trachea, the windpipe.
Yes.
To kind of just put the tube in. But the mass is like pretty large surrounding it. So we wouldn't just be able to go straight in. Like it's kind of pushing it to the right side. So we're kind of trying to discuss options where you wouldn't have to go straight in. Maybe we could put something, but we don't do that here.
Okay.
Like our services don't do, like that would be interventional pulmonology.
Yes.
Okay.
Yes.
Okay, but I'm taking radiation once a day
Yeah.
and chemo once a week to shrink these things. So why aren't we letting that work?
Because that takes time. It's not like it'll work over a week. You'll need weeks, and we don't know. The hope is that it works, but in the meantime, we don't want you to have any complications from the airway. We don't know which way the mass is going to start growing more. It's already pushing it to the right side. So you're breathing fine right now, but what the discussion is that just in case the mass becomes too large, if the radiation chemo is taking too long, that's if it works, the hope is that it will work, but we don't know. Our team doesn't know how long it will take. They basically consulted us to discuss the airway.
Okay.
Okay.
So yeah.
Where's Dr. Brown?
Dr. Brown will be back in the afternoon. He had to go to clinic.
Okay.
So y'all are just discussing more options.
Yeah, we're just discussing options right now. I just wanted to kind of update on what him and I talked about. We still, okay, we still have to talk to ENT and then his primary team.
Who's the ENT? Davi? Lisa Davi?
No.
Ryan Chaston? Okay.
Fine.
So sometimes like one team will be off and the other will be on.
Okay.
I know David saw him, so we'll see
Okay.
what Shasant says. That's also like, he was looking for their note, but.
Okay.
Has Shasant seen you while you've been here? Okay, he has? Okay. So maybe he will talk to him and see what he thinks about it.
Okay.
Okay.
Yeah, I'm gonna make sure that happens.
Yeah.
Yeah, so when we come...
Dr. Brown. I want to talk to Dr. Brown.
Okay.
And I don't want this discussion about changing this whole protocol to go any further. So I'll talk to Dr. Brown.
Okay. I'll let him know to come back in the afternoon and we'll come back
Thank you.
and
Yeah.
see if we've made any progress with contacting the other
Thank you.
people that are part of the team.
Okay.
Okay. Is it okay if I take a listen to you?
Sure.
So you got diagnosed originally in 2011 or 2014? I was reading through the notes and
2011.
okay, 2011. Okay. You can lay back in your chair. Just keep breathing. Okay, turn to the right. Okay, turn to the left. Besides blood pressure, any other medical problems?
I don't even have that problem before.
Yeah, your pressure seems to be doing okay. Open your mouth and stick your tongue out. Say ah. Okay. How long have you been having the stridor?
What do you?
This
What's a
stridor is basically the hoarseness, and then you can the sound that goes when you
6
take it.
weeks
Okay.
since I had COVID.
Never had it before? Okay. And you got COVID twice?
Yes.
What did you do for when you got COVID the second time? Did you have to be hospitalized? Did you need any oxygen? Did you use
Took
any?
over the
It was just like outpatient? What about the first time? It was still outpatient?
I got the
He got the, yeah,
Okay.
fusion.
infusion therapy.
But this time, did you take any medication for it?
Just called medicine.
Okay. And this has worsened since getting COVID? Okay.
And this is squamous.
Mm-hmm.
My first cancer was non-small cell.
Mm-hmm.
They never found the primary, so it's a different cancer.
So your first one was non-small cell.
Right. Unknown primary. Stage 0. Thank God.
Any smoking, drinking?
No,
Okay. Never smoked?
30 years ago.
Okay. Any surgeries that you've had besides that PEG tube?
Had my appendix out when I was 23 years old.
Okay. And then when they put the PEG tube in, do you remember what year that was in?
Yeah, 2011.
Okay. And that was here?
Yeah.
And how long have you been just seeing Dr. Chasson for?
3 years.
Alright, I'll see if Dr. Brown can talk to him before we come talk to you, okay?
Please.
But he did come in and see you? Or did you talk to him on the phone?
Dr. Brown?
No, Dr. Chasson.
Oh,
Chaston.
Chaston. Yeah, he's been here a couple
Oh,
times.
yeah.
Yeah,
I see him.
Yeah.
Okay, so I'll let him know because we were under the impression that like maybe he had, which is what we were surprised about, like that he hasn't come to see him, but he has.
He has come, yeah.
Okay. But the consult note was just by David, so that's why we were a little
Right. And
confused.
Chaston's the one who did his squamous skin cancer on his cheek. Removed that. So yeah, he's right.
When was that?
They have
Sorry.
Daniel from Respiratory. Pick you up with their breathing treatment, okay?
Great, thank you.
Was
Is he getting Duodems or what?
Christina get the next one.
Okay, got it.
when was this on your cheek? Beginning
Over a year ago.
over you. Gotcha.
They just removed it. Was there any treatment for that?
Probably just removed.
Which side? It was on this side? And And then the first one was you were saying the unknown primary.
Yeah.
Okay.
I also had a leukoplakia
Leukoplakia.
removed from my tongue in 2011.
Okay.
And now you get laryngeal
The same time as his cheek.
in 20.
Okay.
You want to see it?
Sure. Okay, I see it. What's happening with the arm?
One other finger form.
That was something was left in his arm, and the nurse.
This happened during his stay or before?
Yes, it's 2 days ago.
It was basically from an IV. He had told the nurse twice, I think 2 separate times, to actually check in on it, and the nurse failed to notify anybody. And it's been getting bigger. But I think he had said it's starting to feel a little bit better at least.
Ultras.
Yeah, he got an ultrasound on it last night.
Okay. Does it feel painful when I touch it?
Yes.
Sensitive.
It extended the line yesterday, but we put ice. It looks better.
As far as the peg tube, is he gonna replace it or what's the plan?
Well, there's some
They were
complications.
concerning down my throat, but because of all the problems, I'm not doing surgery.
Be right back.
Does he run the IV nutrition? Okay. Would you mind lifting up your gown so I can just take a look at it?
That's just a scar years ago.
Okay, so when did they remove it?
Oh, that was after.
11 years ago.
Yeah.
Oh, I thought you said they put it in and it's been in there since then.
Oh no.
Okay.
Yeah, they're basically talking about the complications of reestablishing the peg
Okay.
tube. Because
So
of
how long did he actually have the peg tube in for?
6 months.
6
Yeah.
months? Okay, that makes more sense. Okay. I will come back with Dr. Brown and we will
Thank
further
you.
discuss.
Okay, thank you
Okay.
so much.
Thank
Any
you.
questions for me right now?
No.
Alright.
Thank you.
Want me
Thank
to leave the
you.
door open?
Sure.
And what was your name?
Katie.
Katie?
Yes.
Nice to meet
Hi,
you.
nice to meet you.
Sam.
Sam. And you guys are...
I'm the daughter. This is my husband.
Son.
Gotcha. Okay. Alright, I'm